Hello everyone, nice to have you here. Today we are also going live from Facebook. So I hope everything is fine. Thank you, Nasser. It's great to have you too here. You always add to the whole discussion, so it's wonderful to have you here. I got to ask, anyone on Facebook already logged in? Can you put a message if everything is fine there? Because, I'm not able to check it there. Okay, maybe I can. Okay, it seems fine there too. We have just a few minutes more. 1 minute to be exact. Okay, so we are done. Let me just get everything else organized and we shall start. Yes, I think it all looks okay. Right, so let's begin. And with the greetings to all of you for joining us today on the 73rd episode of the channel. And when we are starting a new set of programs called basically Thinking Outside the Box, Thinking Out of the Box. Now, in case you're new to the channel, I'm Dr. Mandana Donahue. I'm founder of Oral Pathology 360 and Oral Pathology India. And I'm delighted you have taken the time to join us today and every other day that you have been with us. While we take a look at professional advocacy as a solution to the problems we are facing in oral pathology. Yeah, well, here are a set of numbers that are important, at least Well, to me, 24, 16, and 6. If you're wondering what these numbers are, they're years. 24 is the number of years I've been an oral pathologist. 16 was the number of years I was teaching. And 6 is the actual number of years I think I have dedicated to full time oral pathology. So, while I have always been an oral pathologist, but the amount of time dedicated to the practice of oral pathology has changed. And it's been sometimes a little tough staying in touch with oral pathology. I even started a rural practice just to be able to get cases that would come to the practice. And the whole point is that it should not be so difficult. At one point, I even got the management of a private hospital, of a large hospital, to accept that I could join the pathology lab in the hospital. But the MD, who is basically the boss of the hospital and who is a medical colleague, could not really see how an oral pathologist could add to the department. And also, he had the additional thing of saying that the MCI, which is the Council in India for the Medical Practice, does not allow oral pathologists to be a part of a lab in a hospital, and it should only be an MD pathology. Now, these are problems we face. But what really occupies my mind is, should it be so difficult? Should it be so difficult to continue a practice of oral pathology? Now, for me, I have no regrets. I would do it in a heartbeat all over again. I enjoyed it. Whatever I did, whatever it was, I enjoyed it. But what about the next generation? What is the legacy we want to leave for the next generation? Do we want them to find it so difficult to practice oral pathology? In between, I was even told, well, you love teaching so much, why don't you go back to teaching? The point is, teaching should not equate, teaching of oral pathology should not be the only way to stay an oral pathologist. I mean, I love teaching. What about those who don't love teaching? And also, what if you just basically want to do oral pathology and not do the administrative work? We all know teaching involves other things. It involves administrative work, it involves inspections, exams, marking papers, setting out timetables. And for us in India, it also, I think, more time goes in teaching the combined, dental anatomy, oral histology, morphology, and that whole bit of subject, which I think everywhere else would be oral biology plus dental anatomy. So, is it really necessary? How are we going to give a chance to our next generation, to our younger colleagues, to be able to continue the practice of oral pathology without a problem? In theory, all of this should be very easy. I mean, it should not be difficult. After all, it's only fair that all we get and all we want is, we need resources, we need the recognition, and we need some compensation for what we're doing. And it should not be difficult. After all, it's only fair. We put in so many years to become oral pathologists. So why shouldn't we get the resources to provide the services we are trained for? And why shouldn't we get recognition as a part of the healthcare system, or the compensation that matches what anyone else with our years of experience would get? It all seems fair, right? I mean, it is fair. But the thing is, life is not fair. Nothing in life is fair. Nobody promised us fair. But what I think we humans have is the ability to literally change any situation to suit us. We can rise up to a challenge and manage anything. And when we cannot do it on our own, we have the possibility of asking for support from other humans. Yes, we can form groups. And that exactly is at the heart of advocacy. What advocacy, very simply put, is a call for support. Now, we are all very aware of what is social advocacy. That is where we regularly know advocacy from, is social advocacy. And we have seen it working. We have seen it for civil rights. We have seen it for gender rights. We have seen it in the recent times for LGBT rights. And it's also historically, there are many, many examples. But the thing is, social advocacy, well, doesn't really cut it for us because there is no social discrimination against oral pathology, thankfully. So, what it doesn't really cut the purpose, it doesn't really make it right. So, what can we do? Now, I literally stumbled onto professional advocacy last year. I was looking for something that could, you can go out and tell people, we want this, but so much simpler to get a message, a collective message across. So I was literally sitting and looking through the thesaurus when the word advocacy came up. A little more search, and I found professional advocacy. And the place where I found it as having been applied was by the American Counselors Association. It rang a bell. Could it be applied to oral pathology? No, I really think it could, but I'm no expert, so I leave it to you all to decide. And you're wondering why I waited for a year to get this to you. Well, I thought it was necessary to give it a little time to maybe get everyone's attention. I was hoping some people would join and listen if I had to say something about it. So that was the main reason, I guess, and it just sort of took time. Now let's examine what is professional oral pathology professional advocacy could do. We have to look at, for anything, I think I always would look at the why, the what, and the how. So why should we do it? What will we do with it? And how do we do it? Let's go with the why. Now, oral pathology, like other healthcare sciences, is mission-based profession, which means every one of us have joined for a purpose. We maybe wanted to join a particular group of people, a particular patient. There was something we wanted to achieve, and that is how we have joined this profession. And I do know there may be some amongst you and say, nah, I joined it for the money. There may be someone who says it was the easiest branch in dentistry that I could get a specialization. And to both of those, I would say, I think not. If you really think, if this was your plan of making money, I'd say it was slightly badly planned, because you really don't need to put in so many years of work to make money. You can make money almost anyway. This was overkill. And if you just say because it's an easier branch of dentistry, well, actually not so. And also, if your aim is dentistry in today's world, where the branches are so well established, an MDS in oral pathology doesn't really give you an edge in the practice of dentistry. Maybe the knowledge does, because you understand pathology better. And finally, dentistry is about treating problems, diseases. So there maybe the understanding helps, and that gives you the idea of what we can do next. But overall, no, I think it would have been a call for everybody. So professional oral pathology advocacy then would not be about promoting an oral pathologist or a group of oral pathologists. It would be about what is good for the profession as a whole. Then what would be good for the whole profession as a whole? Well, we need to be able to remove all barriers that restrict the access of us to jobs, or us to the, not really to jobs, but to opportunities or situations where we can treat patients, and the access of patients to us. It goes both ways, right? So the whole barriers that need to be removed. Essentially, there is the financial barrier, because we should be having an earning finally if you're going to have a life. You need socio-political awareness. Then there is to be legal access, geopolitical access, which means basically we should not be too far. The closest oral pathologist should not be so far away that nobody reaches you. Now, getting all of these really is a tall order, and I know it's not easy, which is why we need a little bit of organization with us. And that is where the professional advocacy comes in. We need to be able to realize that at the end of the day, if we don't recognize our own worth and recognize that if we are not strong and healthy as a profession, we cannot really help others. We have to be strong, we have to be present, we have to be able to reach get our voice across. We should be able to make a difference to policy making, to everything where health is applied. So, for all of that, we need to be strong first. And to be strong and healthy as a profession, we must address, of course, all the concerns such as parity, and being reimbursed at the same rate as other dentists with a comparable training. Public recognition, of course, both among patients, that means amongst the general public, and amongst our colleagues and peers, and employment opportunities. So, to sum it all up, professional oral pathology advocacy would involve taking action to promote the profession with an emphasis on removing or minimizing all barriers that come in the way of us providing the services we are trained for. So now we heard about this. We heard the possible why of professional advocacy. I'd like to take a few seconds and see what you think about it. At this moment, from what you heard, do you think it is the way forward? It'd be very nice if you put your comments in the comments section. I will take a minute or two here just to hear what everyone is thinking. So we have also today, while you all think of your questions, we have Dr. Arvind Babu, besides the ones who had joined earlier. We have Dr. Divya, Dr. Garima, and Dr. Likita. It'll be nice if everybody else who's there also just, puts in a comment, because then I can see that you're there. Oh, Dr. Madhu. Hi, Madhu. So lovely to have you. Yes. So what do you all think? A yes or no? Let's put a yes or no in the comments. Does this sound like it would work? Then as we examine it further, maybe you can let me know again what you think by the end of this. What do you think? Now I know there's a little bit of a gap between what happens here and what you all are seeing there. So let's see what everyone thinks. By the way, is everything on Facebook fine? Because I can see it happening on YouTube, but I don't know if Facebook is okay. Right, so we are getting some answers. First, we have Dr. Parinita, who's joined us from. Okay. Dr. Parinita has said yes, she has joined us from Singapore. Dr. Divya says yes. Dr. Nasser says yes. Dr. Priti Arun says there should be a group support for oral pathology. Yes. Dr. Manusmurti. Oh, and I finally got the name right. Good morning, Manusmurti. Yes. What are you saying? You're just saying good morning. Okay. Dr. Arvind Babu says yes. Dr. Likita says yes. Yes. Great to have that collective. I also think yes, but well, it's just a beginning. So let's see. Fine. So let's go on and see what else now. So when we went through the why, okay, so now let's go with the what. Now, what would it involve? What is it going to do? Basically, what we will need is a combination of raising awareness among the public, of course, our professional colleagues and government bodies, of what oral pathology is about and what oral pathologists do. Now, to do that means that we first and foremost need to have a clear professional identity that we are aware of. We can't really go and tell others about anything which we are not ourselves unanimously aware of, in a united, combined way. Now, to be able to do that, we need to have what I would say, a proper mission statement and objectives and stuff like that. But we also need to have, maybe a simpler way is to have a code of ethics, a uniform standard of training, so that we all know that all of us know this much when we come out of training, and a set of practice guidelines which include where all we can practice, so that we can also begin to challenge the no, you are not allowed to work in a pathology lab in a hospital. Removing barriers to the practice of oral pathology, such as legal restrictions again on where and how we can work, and barriers of access to oral pathologists, which means we should be available not just in big colleges and in big towns, but we should be available also in primary and secondary centers. And increasing awareness. Everybody needs to know what oral pathology is. We have been trying to do that and we are increasing awareness, but we need to do it a little more in a more organized way. And that brings us to the how. Naturally, these are all tall orders. We require a coordinated effort, and that would require, like someone said, we need to be organized. Yes, we need to be organized. There has to be a coordinated effort. We have to have a strategic thinking. If we are going to go and portray a certain image, then we cannot halfway through say, oh, no, 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 let's scratch that, let's just change it, because we cannot appear to be unsure. Appearing to be unsure has very bad effects. It's like what has literally happened to the whole of medical fraternity in the last 1.5 years, 2 years with corona, is because people have been watching science develop step by step. What would have normally not been in the public eye, because they would only see the end results, has come out in the public eye. Now it's a science, it's learning step by step, and that has instead of making people feel more assured that okay, doctors and the medical profession are doing everything, but actually it's making them think that we don't know what we're doing. So now that is, of course, this was inevitable. But what we are going to plan and set forth, there is no need to be unsure. We need to have it very strategically decided and planned beforehand. So every time we make a presentation, we make an appearance, it has to be decided as a group. And then, of course, we need an unfettered exchange of information where everybody is ready to come out and say what needs to be said with no fear of things like the DCI, the colleges, our colleagues, or even our own association for that matter. So, communication is essential. Outreach we need to have. Mobilization is something we need to have. And a great amount of time and definitely a certain amount of funds, because we will need legal support. We will need, if you're going to be contacting or connecting with ministries that are obviously in charge, the Ministry of Health, even if it is through the DCI, we really need to begin to organize ourselves. And this is not something one person can do. This is something that requires a lot of planning, a lot of work. And I don't know, what we got to ask ourselves is, in theory, I know we all want oral pathology to get ahead, to get better. In practice, where are we? Are we there? Are we in a place where we are ready to do the work, to, take the hours, do that much of volunteer work, get ourselves organized? So, with that, I'm going to stop talking and let's have a little discussion. I know that we have with us Dr. Nasser from the US, and they have oral pathology fairly well established there. So, what I would like to know now is what he thinks. Um, did they have any plan? Did they at any point do anything that, got oral pathology better recognized there? And yes, Dr. Arvind says a big yes. Yes, I know. We really need to do that. Yes. And yes, good morning to everybody else who has joined us. So, what do you all think? We got some more yeses. But what about the answers? How are we going to get this through? It's a tall order, it's not easy. How are we going to get this through? Frankly, I would have to say that it would seem like the people or the organization best placed to do this would be our association. One, they have the organization. They already have the membership. I think already probably at the very least 60 to 70% of all oral pathologists in India are members. And well, they have the funds, and the funds have been finally raised through oral pathologists through the years. It seems like a good way to spend it for oral pathologists. And I know today someone may be wondering, and how does this relate to the rest of the world? I think for a lot of the parts of the world don't really have oral pathology as yet, or maybe do not have the numbers as yet. But at the end of the day, if we are the largest, and if we can work this out, I think we can make a difference uh, for all the other countries that would want to set up too. Okay, Dr. Nasser has, he says, Academy for All Pathology pushes a specialty acceptance between all specialities. That is the American Association of Oral and Maxillofacial Pathology. Yes, that has come back. So that brings us back to our own association. And thank you, Dr. Nasser. Yes. So, yes. What about us? What can we do? I wonder if today we have anyone from any other. Dr. Parinita is here from Singapore. How is oral pathology there, Dr. Parinita? Anything you can tell us? Oh, and Dr. Joss is here. Yes. Good morning. Good morning. Yes. And, I always remember something Professor Joss once said in one of our sessions, and that was that being an oral pathologist, you need to be like a street fighter. You can't just sit back. Now, I know he was not meaning for us to actually go out and fight, but it's just that we need to be tough and we need to really work very hard to get ourselves recognized. And sadly, I think we have to accept that from the home of the largest fraternity that we have not done the hard work. We have not got ourselves, we got too complacent sitting in colleges and institutions and did not think of oral pathology on the outside of the teaching fraternity. And that is actually what has brought us here. Yes. So, any suggestions? I am open to suggestions. I don't want to drag today's session on too long, but I will give it 5-10 minutes. I'd really like to know any suggestions you have on how we can. Yes. Yes, Professor Joss, in India, oral pathology is recognized. We are recognized as a specialty, but the only problem what we have is our recognition is very limited to being within the colleges. And what I personally feel is by only being in the colleges, we are sort of separated. Oh, yeah, sorry, 1 second. I mean, we have started the program. Sorry, that should not have stayed on. Okay, so we are very separated from clinical dentistry, from everyday dentistry. If you think about it, every clinic or every branch is there in clinical dentistry. You will have, if we have a general dentist and you think about a clinic, they will interact with specialists almost from every branch. The one branch that is woefully absent in the entire clinical setup is oral pathology. We have distanced ourselves too much. And considering we keep saying and we enjoy saying how pathology is the foundational science, and yes, it is, but as the foundational science, we are no longer there. I mean, I don't know how far we have a right to call ourselves now the foundational science. I guess the science can, but we as oral pathologists, we have been distanced. We have been very distanced from. If you, I have taken third year exams while I was a teacher because oral pathology is in India is taught in the third year to the bachelor students, to the dentists, and half the time they could not tell me what. One of the questions I used to ask is, so at what point will you call an oral pathologist? What are the situations in your clinic, in your eventual clinic, that you would call an oral pathologist? And most of them could not think. They would say things like, or to take a biopsy, say, wouldn't you call an oral surgeon? So I used to try and get them to say that you actually need to think that the diagnosis is done by the oral pathologist, And for the fact that periapical lesions are so common and so commonly treated, and periodontal lesions are so common, and if you think about the fact that the most simplest thing is that old adage that you don't take any tissue out of the human body without putting it through a pathological analysis. And where are those? Even our departments don't have. If we attempt to do something like study a periapical granuloma from our archives, I think almost no departments will have enough tissue. And that is where we are separated from clinical dentistry. So, what does Dr. Arvind have to say? Yes, Dr. Arvind says like minded oral pathologists should join together apart from the association. I think we'll just have a whole number of, separate broken up associations. I don't know. And Dr. George says, our colleagues and patients still regard us as a pure lab science because of our predominantly bench bound activities. That is very true. Yes. We are predominantly bench bound, yes. And I think that may not have been a problem if the patients thought so, as long as our colleagues at least didn't think so and, got us involved in more things. And what Dr. Arpan Shah says, consistent private practice in oral pathology can be an answer. Yes, of course, it can be an answer, but it will take a very long time. And it is right now very hard. And I do know that you are practicing, and that's great. I don't know. I have tried it. I have definitely tried it, and it is very difficult. And I do know that there are a number of others doing it. And again, if you are thinking, there are some oral pathologists now who go and set up a dental practice instead, and I would tell them no, setup is a regular thing. So what we got to do is think about the time that it takes to set up a dental practice would be the same as setting up an oral pathology practice. And I seem to have missed something here from Dr. Nasser. Thank you, Dr. Joss, for bringing it to my notice. Yes, that's a good one. Yes, I agree. In the States, it's oral pathology is a very well established specialty and subspecialty. And by the way, I believe general pat reluctancy is based on greed. Very possible. And I mean, it is true they probably do not want to share the cases. And I agree with that, which is why I always also say that, and I have had a number of general pathologists who are great friends, but but the point is, at some point, there's no harm in us beginning to say, this is our area, this is our boundary, this is where we work, this is where we are better, and I think that needs to be the case. Okay, what else do we have? Dr. Arvind says we have to rephrase the role of the oral pathologist, and students should be taught as clinical aspects and clinical pathology. Yes, clinical pathology, very true. Well, we need to actually, but the thing is, even the clinical pathologists with pathology we teach, Dr. Arvind, is literally related, with big lesions, noticeable lesions. It's not doing anything with them. What is the major part of dentistry, if you think about it, where we could get our colleagues seriously involved, is really perio and cons. I mean, when you think about it, periapical lesions and periodontal and gingival lesions. I think we need to also get ourselves involved there. But you are very right. And we have Dr. Elisa from Zambia. Welcome. Dr. Likita. Hi, Likita. Collaboration with general pathologist is possible, definitely. Uh, but in what way? I mean, yeah, if we can go and join a general pathology lab and be the person that they would have on board to actually check the oral pathology tissues is yes. Hi, Brendan. And Dr. Akshay says inculcating the importance of the subject from the undergraduate itself. I see aspirants for fear taking oral pathology. That is true. In the last year, of course, that was a particularly bad time, but a lot of people were, I mean, I was the saddest when one person told me, I regret having taken oral pathology. That really was upsetting, yes. And that is sad. That should not happen. Dr. Sandhya, even third BDS should have OPAT lab posting in addition to OPAT postings in internship just to create complete awareness of specialty at undergraduate level itself. They are our future. Yes, they are our future. Yeah. And I also always find, considering that we spend, I think amongst our branches of dentistry, oral pathology spends the longest, the most amount of time with undergraduate students. So the fact that we still don't seem to impress upon them what we do, I think, is generally our own failure. I have to say, collectively, we are failing there, and we got to work at something to see how we can overcome that. Dr. Shah, efforts should be taken by us that the public patients recognize us as specialists, creating the awareness about our specialty. Yes, that is somewhere where the advocacy can come into group. Yes. And Dr. Joss, clinical oral pathology. Yes, clinical oral pathology, definitely. Dr. Nasser agrees with that. Dr. Priti Arun, during post graduation, we should have been FIB? Okay, I'm sorry, I can't get that. What is FIB? Okay. Uh, and we should be given more clinical approach. Yes. Dr. Sunita Sumesh, I agree with Dr. Arvind. So maybe we should make the oral pathologist involved more in the clinical diagnosis of the case. Right. More oral pathology labs and other dentists helping each other by sending more cases to us rather than general dentists. Yes. The thing, there is a, I like the fact that we need to learn clinical, we need to be in the clinics. But in India, we have one thing we should always remember there is a narrow, there's a thin border that we should not cross. Finally, there is also a branch of oral medicine and diagnosis. We have to somehow be able to establish the line. Because if we don't establish the line, then we will be fighting with them. And I think the more effective way is that we join up with oral medicine and with oral surgery, the three departments that together are a little more hospital based compared to the rest of dentistry. And if we join forces, maybe we can begin to ensure that at least every tertiary hospital that treats anything within the oral and maxillofacial region has all the three specialities on roll. Uh, because otherwise, I don't know, unless we actually get together and begin to format a line and to say exactly where we are going to draw the line of what we are going to be doing in the clinic, and or what is our level of clinical involvement, and what would be the oral diagnosis where we will not enter. It's difficult. These are exactly the difficulties I have been thinking of. Yes. And training of students to take biopsies and give the diagnosis themselves like we do to treat patients. Well, the thing is, patients, every general dentist treats patients, but not every general dentist is going to be able to really sign out a report. So I don't know how that will go. Dr. Joss, we should be concentrating on what is clinically relevant to BDS training and not so much the deep and complex histological details of oral lesions, except except for the clinical implications. I think I totally agree with that. That is sampling. Yes. I think that is very true. We need to have ourselves in the very specialized oral pathology setup, but we also need to get back to dentistry. We are somehow forgetting that we are dentists at heart and dentists at the base, at the basic level. We are dentists, and it was interesting when I was, I think when I was making the logo of my oral pathology India, and I started with the microscope, as everyone does. And it was my husband who said, you guys, you're dentists. Why don't you have something dentistry in your logo? Which is why then the mirror and probe got involved in both even the oral pathology 360 has a mirror and probe. And I think, yes, sometimes we tend to forget. Maybe we are too close to it, and maybe the pathology has become too much a part of us. We tend to forget the dentistry part. We need to get back there and, claim our right to the part that is us. Dr. Rupara, hi, doctor. Yes, integrate triple O, at least at the institutional level, if not by DCI. Yes. Integrate. Are you suggesting we join up again? I think that would cause a lot of difficulty and also would reduce the number of jobs available, which is already one of our problems. Dr. Priti Arunia, there should be a drive to get all oral pathologists together and provide the collaboration with clinical practitioners as a consultant or group practicing of oral pathology. Yes, that is true. Okay, now, Dr. Joss, we have to remember that in South Africa, they have fought this battle. So there's a good amount of knowledge from there. Dr. Joss says, what is really helpful is to promote oral pathology amongst general medical practitioners. Yes, I think that is definitely. And Dr. Rupa, I agree with Professor Joss. How stapling errors impact the outcome. Oh, okay, sampling errors. Histopathological diagnosis, yes. Dr. Nasser says most of the oral pathology training in the States encompasses clinical. That is true. Although I don't think, if I'm not mistaken, Dr. Nasser, oral pathology and oral medicine are a single subject there, or am I mistaken? I don't really know. And Dr. Manusmriti, proper referral of cases for discussion and appointment of oral pathologists of oral cases exclusively. Yes. Another thing which, from my own experience and which I have seen before, by virtue of the major part of oral pathology happening within the colleges, we are limiting access to general practitioners. And at least in India, most of the colleges are have very complicated systems for their own oral pathology lab to accept tissues from outside, and very often you are the only oral pathologists are within the college. So if you are not going to accept tissues from outside, you're literally closing off the access of the general dentists, and then it's easier for them to just go to general pathology. I remember when I was in CODS in Davangere, we had quite a time, but we managed to make it less complicated so that if a person could directly submit, any dentist could submit cases directly to the department and get their reports. Now, things like that are something that in an area-based situation and college-based situation, we can begin to start doing that. But we can also begin to organize ourselves, I think, in terms of where we are having shortcomings and difficulties. Organization is what we need. We need to organize ourselves and set up standards, like Dr. Arvind said. Maybe at the end, we will just have to get ourselves a group of like-minded people from India, and hopefully our colleagues and friends from across the world who have already done this and are a little ahead of us on the road. There is never any good reason for reinventing the wheel. So if we can get their help, get them in, and finally, oral pathologist is an oral pathologist. Location does not count, and we can move ahead. Yeah. Dr. Brendan, standing up for ourselves to put oral pathology on the dental treatment map as it is neglected. Inculcate a habit among surgeons to send cases to oral pathologists. Yes, very well said, Dr. Brendan. And I know you have worked very hard for that in your own town. And I know you have been successful. But yes, that is one thing we need to keep sharing experiences of people like you with our younger colleagues. Uh, Dr. Arvind says, I accept to give due respect to oral medicine and oral surgery, but that's only during 3 years. But all clinical knowledge for PGs help for their lifetime. That is very true. The clinical knowledge, the learning, that another thing is our learning of oral pathology. You're very right. The learning of oral pathology definitely includes the clinical setup. Oral pathology PGs do get posted regularly into oral surgery and oral medicine, and their PGs come to us, the postgraduates, and we do need understand that we need to collectively learn. Otherwise, we can't even communicate, which is essential. But yes, the practice of oral pathology is something we need to begin to think about too. Dr. Niharika says yes. Dr. Sasaki, in India, can oral pathologists diagnose oral cytology specimens with single sign? Well, I will ask one of our colleagues to answer that. As far as I know, we don't really do cytology, but yes, if we do a cytology, we can report it. Yes, we can sign out. Is from my understanding, we can sign out anything as long as it is from the oral and maxillofacial region. Is what I know. I'll let those who are in more current updated practice to uh, chime in on that. Dr. Nasser says, I agree. And but yes, but oral pathology laboratory. Not sure what that is. Okay. Dr. Joss says the IAOP, that's our international association, saw the light and it is branded as the International of Oral and Maxillofacial Pathology and Medicine. Well, Dr. Joss, that the problem is that at the time of our seniors, of the original group who started oral pathology, we split up, and I think we split up with quite a bit of problems. So, and today we are two very well established and very separate with difficult overlapping areas. But we are very separate, and we are also already too many on both sides, so that becomes difficult in any way to consider. And there was at one point a talk about joining, but I don't think joining the two is going to really help in the true sense, because oral medicine is essentially helping the same problems that we are helping. So I think we need to just think a little beyond that too for ourselves. Dr. Nasser, okay, oral pathology programs have extensive training as much as oral medicine and probably more. Although I agree with you, it becomes somewhat territorial. Yes, it does become very territorial. We have a great experience of our territories here. Yes, Dr. Malti has answered, Dr. Sasaki. We do sign a lot of cytology tests, especially pemphigus, etc. Okay. And Dr. Arpan, we really have to establish ourselves akin to general surgical pathologists in order to get value and trust from the referring clinician and patients. Yes, we do. And continued learning is a solution for this. I don't know how much more learning. I mean, learning essentially is the and definitely is essential, is necessary and will help. But at some point, we need to get people to realize that we have learned so much already. We are already trained for so much, and we really need to be there. I don't know. When you think about it, Now, I've been running the channel for some time, and I find when sometime back I was looking for an expert in salivary gland diseases from India, and I find that not enough of us get cases, and therefore we do not have experts. And that's because almost most of the salivary gland lesions directly go to general pat. They don't even reach us. Now, these are the things that happen. We have to begin to establish. Actually, I think we need to just, and this is my way of thinking, and it may be very faulty, but maybe we just basically need to simultaneously do a number of things. We need to increase awareness. We need to improve our training. We need to begin to establish the laws that allow us to actually do the work that we do. Now, while we are allowed, for example, like I said, to sign out any oral pathology report, but when it comes to joining a hospital's pathology, there is apparently a law from the MCI and from the accreditation group that says that anybody within the pathology lab should be MD pathology. So that in India we are MDS, so that removes us from the setup. But the factor remains, why should the MCI control what a dentist does? We are dentists, and we are going to be only reporting oral and maxillofacial pathology cases. So these are all so many, this whole combination of things that we need to start sorting out at some point. It's not easy. Yes, in oral pathology, one needs to be constantly active in and not only promote our discipline to our sister specialities, but also others. Yes, I agree. Yes, we yes we need to be all rounders, everything, and it takes a lot of time. And I know. I think when the last time we spoke, and I think, Professor Joss, if I'm right, you told me that there are about maybe 50 oral pathologists around Africa, which has almost the same population as India as a whole. But we are probably around 3,000. And that is another thing. We don't even know how many we are. Now, we really need to get that organized. Nobody really knows how many we are. And actually, our dental council would know, but we need to get that number from them. And can we go more into research, since we are one specialty who can understand all the other branches and can do in-depth study? Yes, we can go into research, but again, that how many would want to go into research? That is again a limitations. I think we should aim for a situation where you choose, where you have the option as an oral pathologist to become a teacher, to become a researcher, or to go out and practice. I think that is what we deserve after so many years of study, and that's what we need to fight for. Yes, Professor Joss is sharing as to who all we need to actually, it is very true, with dermatology, general medical practice, head and neck oncology, general surgery, gastrointestinal, rheumatology, hematopathology, definitely pediatrics, ENT. I think we need to really interact with everybody. And we really need to be a lot more noticeable. And I think our number, I mean, we are, whatever it is, we are around 3,000. It should not be so difficult actually for us. We should be able to, if each of us chooses to put in a little time every day, it is possible. But we need organization. Otherwise, we will all be doing different things in different areas. The organization is what we need to get together. And I really have no answer for that at the moment. So the complications of, I have it. I have this information because I was conducting something about the curriculum of our training. And during that, I found that a few years ago, our association has submitted an updated curriculum sorry, to the dental council, who runs the entire dental setup in India. Basically, they are involved in all the rules, regulations, curriculum, etc., registration, and there's still not even a news from them. Now, this is where we lag. Probably by the, if it's already a few years old, the fact remains that by the time they even look at it, it is already going to be outdated. And we need to be able to do something about that. We have to be able to get our voice out. I can suggest that we send an open letter to the DCI president signed by 3,000 odd of us, and that's all I can think of. But we need to get there. Dr. Arvind says, Dr. Joss, I accept your views. We have to explore ourselves. We have lots of opportunity. And I have to say, Dr. Arvind actually does that. He does a lot of different things, and it's amazing the kind of things that he does. But this is where we need to have people like him and then translate it to oral pathology everywhere. Yes, definitely. Pediatrics and ENT, yes. Yes. Dr. Arvind, I think I can open that can of worms, but I think there's going to be, it's that, I think we'll have that as a separate discussion. According to me, definitely. And I don't know, I think the entire syllabus, the way we teach needs to change. I think we need to get the syllabus and the training that is happening in countries where oral pathology is doing better. We don't need to reinvent the wheel. We need to see how they are conducting their training and maybe then modify it to the way we want. Right now our training is something from a long time back, and we are going on. And a part of the problem with our training, the one I see, is that we train oral pathologists to be teachers. We do not train oral pathologists to go out and be oral pathologists. There's a difference between being of course, I do realize that those who are teaching are also doing oral pathology, but there's a difference. There's a different kind of skills that are required, especially here where we are required to do things like teaching oral histology and carving and stuff like that. But why would an oral pathologist going out to practice need to know those? And in which case, we are wasting the amount of time that we give them to learn those things. It's not necessary. So, yeah, we could do a little bit of tweaking, definitely. I would love to get my hand on what was the new syllabus that was suggested to the DCI, which the DCI has not looked at. I would really love to get my hand on that and see what was suggested, but I don't think that's going to happen. Yes, Dr. Arpan is agreeing with you, Dr. Arvind. Yes. I know, Dr. Arvind, you have been joining and you have very successfully been practicing with medical practitioners too. And that is, yes, we need to get that. Okay, before I sort of overstay my welcome on the channel and go on for too long, let's take it. I think next month, let's all think and maybe get back together to deciding how we can organize ourselves, the ways to organize. First, let's have this question again. So now how many think that professional advocacy for oral pathology could be the answer? We had done it in the beginning. Let's end with that again. And then we can decide. If you put a yes or no, it will be nice. Do we think that professional advocacy will help? An organized effort. This is, yes, Professor Joss. In South Africa, sadly, most patients with initial oral lesions consult medical GPs because the public doesn't recognize dentists as being competent in handling non-carious and non-periodontal oral path. That is very true. That is actually probably the same thing everywhere because we are not really recognized. And actually, very often in India, I would say, even though we are so many of us as dentists also, still a lot of people who get a toothache will go to their family doctor. And that's a toothache, which I mean is dentistry in the most practical, basic dentistry. Still, they do. And so, if you have an ulcer or something like that, they just definitely go to their clinical practitioners. So, we need to get in touch with them. Yes. Okay, we've got some results coming. Dr. Arpan says yes. Dr. Malti says yes. Dr. Sunita says yes. Dr. Manusmriti says yes. Dr. Ashok says yes. Dr. Parinita says yes. So, and Dr. Joss says yes for sure. Yes, I think we should begin, Dr. Arvind. Yes. And yes, I think we should begin to somehow get ourselves organized. Who knows? Maybe someone from our association will listen to this, and maybe the association will decide to take over and do the required need. The Indian Dental Association has an advocacy, professional advocacy program, although I couldn't get any of them to talk about it, that aside. But maybe we can, get it going with us. Yes. Dr. Niharika, yes. Okay, so let me go back to sort of ending the session. Dr. Elisa also says yes. Okay, thank you, everybody. And um, going back to our PowerPoint. So, yes, that is just to remind everybody, if you liked it, please hit like, and also please subscribe. And if you're on our Facebook page, you can follow the page. This is what will really help us and help the channel to get more and more people involved and with us. So I think we can say from this discussion today that yes, we are ready, but we need to work on how we are going to go on with it. Now, I also have some interesting breaking news. And yes, that took some work to make. So, yes. So, what is the breaking news? Yes, it's we're starting a OP360 short videos on the series that are listed there, because you're all aware that for basically this is an equal opportunity channel. We try to bring everybody who has the skill and the knowledge, irrespective of just how senior they are. We do bring in the seniors and the experts, but we bring in everybody. We try to bring in everybody, but there is a limitation of time and a limitation of resources. So now I've started this series and I set up the website just to be able to do it, and where you can submit your short videos. So it will go through a sort of a review, and uh, an expert will also check the content, and then we can upload them as short videos on the channel. You go to our website. It's still not very complete, so don't get shocked if it's very basic. I really did just put up this one page mostly just so that you could find these details, find out and see if there is something you want to present, and you can start presenting, you can start sharing your presentations. And the dental short stories is still going on. It will be on for another 15 days. And I have to say, I'm surprised. I have been receiving a lot of entries, but not that many from oral pathologists. I mean, buck up, guys and gals. You got, this is a good chance. Last year we did the case presentations. The idea was to tell the world we exist, we do cases, we do complicated cases, we are there around the world. There are a lot of us. And this time in the dental short stories, again, a chance to tell the world we are there. The book, every entry is going to be published in a free ebook. And of course, there's also going to be the 10 winners who will go ahead and get get a chance to present it online. It is open to every student, the entire members of the dental team. So just and you can share it also, please, with your departments and everyone else. You have access to students, so please do that. There are a lot of prizes, a lot of chances. Don't let it just go. It will be interesting. And yes, the link is in the description. And coming up next week is going to be another oral pathology basics. We are going to go to the lab with artifacts, a snag in oral histopathology lab by Dr. Tamiz Chevron. So join us for that too. And now let me see. what we have a few more comments here. Let me just go through those and then we are. Yes. Thank you, Dr. Nasser. Thank you so much. Yes, I do try. I do try, and I hope I can make a difference. And yes, and he still says yes, he agrees. Dr. Malti, thank you for organizing Certificate of Appreciation. Certificate of Appreciation? Sorry. Okay, I'm not sure what that is about. And you must start. Yes, Professor George says you must start, or like we still have to improve. Okay, with showing what oral pathology can do and mean for general dentists practicing and training. Yes. So, and that is that. Dr. Niharika, maybe we should involve students in more oral pad conferences. Yes, definitely. Yes. Thank you, Dr. Divya, for being here. Thank you, everybody, for being here. I do hope I will see you all next week. Definitely, there is going to be that on the Tuesday. We have a basics topic. Please share. Please support the channel. Please join us where you can. And yes. So, with that, I shall say bye. And sometime next month, I will share it. We will have another session and maybe we will discuss on how we can set up the, you know, the advocacy. Thank you again, everybody, for being here, for giving me the time, for taking part. Thank you so much. Have a great week. See you next time.